Welcome to Children's Hospital Boston, where we are committed to providing the best and most innovative care to our pediatric patients. My name is Eva, and I'm a pediatric nurse. Today, I would like to take a few minutes to talk to you about family-centered rounding. Family-centered rounding is one of the ways in which the hospital team communicates with patients and their families. Every morning, the team gets together to talk about what is going on with the patient, what the plan for the day is going to be, and to answer any questions. Patients and family members are always invited to participate in family-centered rounding, but it's entirely your choice if you would like to participate or not. If you are unavailable or if you prefer not to participate, there will certainly be other chances for you to meet with your child's doctor or get information about your child's condition. Family-centered rounding is only one of those options. Before your first rounding experience, a member of the team will explain what you can expect when you participate in family-centered rounds. They will ask you to complete a patient family preference card, which will be posted outside of your child's room. This card will tell us of your choice to participate in family-centered rounding, and whether or not you would like someone to wake you up if you're asleep when rounding begins. At the beginning of the rounding visit, one of the doctors will take the lead and introduce the team to you.
Hi, Ms. Norris. My name is Grant Rowe. I'm one of the resident doctors. This is Dr. Abaya. She is my supervising resident. This is Dr. Ted Sektish, who's the staff physician today. This is Sue Dixon, one of the nurses in charge today. So I'm just going to recap for the team the events that brought you into the hospital, how Jayla did overnight. We'll do a physical exam, and we'll go through the plan today step by step for our goals. And of course, your input is always important.
Children's Hospital Boston is a teaching hospital. As part of our work here, we also have nursing students and medical students who learn from the experience of doing rounds. There are two important goals for family-centered rounding. The first goal is to bring the entire team together to check on your child. We give particular attention to any changes in the past 24 hours. When you participate in this conversation, you can help us to stay up to date with the most current information about your child. Your input is very helpful in understanding your child's condition, and we want to hear from you.
Ms. Norris, has Jayla had pain like this before?
Little, but not this severe.
And is that what made you come to the emergency room?
Yeah, it really worried me a lot.
The second goal is to make a plan for the day. We want to review our next steps for your child's care, and when the time is right, we want to start planning for when your child goes home.
So Cody, you were admitted last night with hemoptysis and you've been doing fine overnight, I understand. Is that right?
That's correct.
That's great. Well, if you continue to be stable like this by tonight, you'll be going home. And then I'll have you follow up with your primary care physician in a couple days.
Good.
Every day, the teams have to round on a lot of patients, and we need to share that time with all patients and families. Rounding on each patient will only take 4 to 6 minutes, and then the team moves on to visit the next patient. We want to make sure that you have all the information that you need and that all your questions are answered. If time does not allow us to address all of your concerns, your doctor may need to come back after rounds and continue the conversation.
When I was in this morning, Mom had asked if Cody continued to have the hemoptysis, what we would do.
It's an excellent question, one that I think would take a little bit more time to explain thoroughly. So if it's all right with you, I think after we're done seeing the rest of our patients this morning, I'm happy to come back and explain that more in depth.
Okay, that would be great.
Before rounds begin, you may want to take some time to write down any questions you might have for the team. You and your child should feel very comfortable asking questions during rounds, and if there's anything you don't understand, please be sure to ask for more information. Working with the team and making decisions about your child's care can sometimes be overwhelming, but we want to make sure that everything is as clear and as easy to understand as possible.
So this is Cody. He's a 16-year-old male who came in with hemoptysis.
Can you explain what hemoptysis is?
Sure. Hemoptysis means that when you cough, you have some blood coming up too when you cough.
Oh, okay. That sounds about right.
Okay.
Yeah.
If you would prefer not to participate in family-centered rounding at the bedside, there are other ways for you to communicate with the hospital team. It may be possible to meet with the team in the hallway outside of the room instead of meeting in your child's room. Although meeting in the hallway can be less private for you, this might be a better choice if you prefer not to discuss your child's condition in front of him or her. You can also bring your questions to your nurse. This is particularly helpful when you know that you won't be able to attend bedside rounding with the team. Your nurse can always pass along the questions to your child's doctor. They can also help you keep informed of any updates from the doctor if you're unable to attend or choose not to attend rounds. At Children's Hospital Boston, we are committed to providing excellent patient care, and clear communication is an important part of that commitment. We want you to understand your child's condition and care plan. We want you to be able to communicate with all members of the team because you are part of that team. We hope this video was helpful in learning what family-centered rounding is all about. Please let us know how we can help you, and thank you for choosing Children's Hospital Boston.